Diabetes. It's a word that carries weight, a diagnosis that can feel daunting. For years, managing blood sugar has been a daily struggle for millions. But what if there was a new tool, a more effective way to take control? Enter Mounjaro, a medication offering hope and a brighter outlook for those living with type 2 diabetes. This isn't just another medication, it's a potential game changer. Mounjaro represents a new era of diabetes care, one focused on comprehensive management and improved quality of life. In the following sections, we'll delve into the science behind Mounjaro, explore its benefits and potential side effects, and empower you with the knowledge to make informed decisions about your health. Mounjaro, known generically as Tirzepatide, is not your typical diabetes medication. It's a GLP-1 and GIP receptor agonist, a mouthful that translates to a powerful way to manage blood sugar and potentially even lose weight. This innovative approach sets it apart from older medications, offering a more comprehensive way to address the challenges of type 2 diabetes. Instead of just focusing on insulin, Mounjaro works by mimicking the effects of two naturally occurring hormones in our bodies, GLP-1 and GIP. These hormones, typically released after we eat, play a crucial role in regulating blood sugar levels. They slow down the release of sugar into the bloodstream, helping prevent those dangerous spikes that can harm your body over time. Mounjaro's dual action on GLP-1 and GIP receptors is what makes it so unique and effective. Let's break it down. GLP-1, or glucagon-like peptide 1, slows down digestion and tells your pancreas to release more insulin when needed. This dual action helps keep blood sugar levels from getting too high. On the other hand, GIP, or glucose-dependent insulinotropic polypeptide, enhances insulin secretion from the pancreas and also increases insulin sensitivity. This means your body uses insulin more effectively, further aiding in blood sugar control. By targeting both GLP-1 and GIP receptors, Mounjaro provides a comprehensive approach to blood sugar management, offering a level of control not seen with many other medications. The benefits of Mounjaro extend beyond just blood sugar control. It's also been shown to promote weight loss, a significant advantage for many individuals with type 2 diabetes. This weight loss isn't just about fitting into your favorite jeans. It can lead to improved insulin sensitivity, reduced risk of heart disease, and an overall improvement in your health and well-being. Another benefit of Mounjaro is its convenience. It's a once-weekly injection, meaning you don't have to remember to take pills multiple times a day. This can be a game changer for busy individuals, making it easier to stick to their treatment plan and achieve better blood sugar control. Section 5. Taking charge of your health, Mounjaro administration, and dosage. Mounjaro is administered once a week via injection. It comes in a pre-filled pen, making it easy to use at home. Your doctor will determine the right dosage for you, which may be gradually increased over time to achieve optimal blood sugar control. It's crucial to follow your doctor's instructions carefully and never adjust your dose without their guidance. Before injecting Mounjaro, always inspect the pen to ensure the solution is clear and colorless. Choose an injection site on your abdomen, thigh, or upper arm, and rotate the injection site each week to prevent skin irritation. After injecting, dispose of the pen safely in a sharps container. Section 6. Navigating the terrain side effects and how to manage them. Understanding the potential side effects of any medication is crucial for your health and well-being. Like all medications, Mounjaro can cause side effects. It's important to be informed so you can manage them effectively. Most side effects are mild and tend to subside over time. This means that while you might experience some discomfort initially, it often gets better as your body adjusts. Common side effects include nausea, vomiting, diarrhea, constipation, and stomach pain. These are typical reactions that many patients experience. These side effects are usually temporary and can be managed by adjusting your diet, staying hydrated, and ensuring you get enough rest. Additionally, taking over-the-counter medications as recommended by your doctor can help alleviate these symptoms. Always consult your healthcare provider before taking any new medication. While most side effects are manageable, it's crucial to be aware of potential serious risks associated with Mounjaro. These include pancreatitis, which is a serious inflammation of the pancreas, and thyroid tumors, including medullary thyroid carcinoma. These conditions are rare but require immediate attention if symptoms appear. If you experience severe abdominal pain, persistent vomiting, difficulty breathing, or a lump or swelling in your neck, seek immediate medical attention. These could be signs of a more serious condition. Remember, your health is paramount. Always communicate openly with your healthcare provider about any side effects you experience. They are there to help you navigate these challenges safely and effectively. Section 7. Weighing the risks. When Mounjaro might not be right for you. While Mounjaro offers numerous benefits, it's not suitable for everyone. It's essential to discuss your medical history with your doctor to determine if Mounjaro is the right medication for you. For instance, individuals with a personal or family history of medullary thyroid carcinoma, a type of thyroid cancer, should not use Mounjaro. Additionally, Mounjaro is not recommended for people with type 1 diabetes, diabetic ketoacidosis, or severe kidney or liver problems. Pregnant women and breastfeeding mothers should also avoid using Mounjaro, as its effects on these populations haven't been fully studied. Section 8. Mounjaro and weight loss, a new horizon. Beyond its blood sugar-lowering effects, Mounjaro has garnered significant attention for its potential as a weight loss medication. Clinical trials have shown impressive results, with participants achieving significant weight loss compared to those on placebo. This has led to excitement about its potential to address the growing obesity epidemic. It's important to note that while Mounjaro shows promise for weight loss, it's not a quick fix or a substitute for a healthy lifestyle. It should be used in conjunction with a balanced diet and regular exercise for optimal results. Furthermore, more research is needed to understand its long-term effects and safety for weight management. Section 9. Real-world results. Stories from people using Mounjaro. The impact of Mounjaro is best understood through the experiences of those who use it. These personal stories highlight the transformative effects of this medication. Many individuals with type 2 diabetes have reported significant improvements in their blood sugar control, which has been a game changer for their daily lives. They have also seen a reduced need for other diabetes medications, allowing them to simplify their treatment regimens. Additionally, many users have experienced weight loss since starting Mounjaro, which has further contributed to their overall health and well-being. Their stories offer hope and inspiration for others looking for effective ways to manage their condition. These real-world results provide a sense of community and support. One such story is that of Sarah, a 55-year-old woman who struggled with type 2 diabetes for years. Her journey is particularly inspiring. Despite trying various medications and lifestyle changes, she couldn't achieve optimal blood sugar control. The frustration and challenges she faced were immense. After starting Mounjaro, Sarah experienced a dramatic improvement in her blood sugar levels, which brought a new sense of hope and relief. She also lost a significant amount of weight, which was an unexpected but welcome benefit. This weight loss has positively impacted her self-esteem and daily activities. She now feels healthier and more energetic than she has in years. Sarah's story is just one of many that showcase the potential of Mounjaro to change lives for the better. Section 10. The future of diabetes management. Is Mounjaro the answer? Mounjaro represents a significant advancement in diabetes care, offering a novel approach to blood sugar control and potentially even weight loss. This medication is designed to address some of the most challenging aspects of managing type 2 diabetes, providing patients with a new tool in their treatment arsenal. Its dual action on GLP-1 and GIP receptors sets it apart from older medications, providing a more comprehensive way to manage the complexities of type 2 diabetes. By targeting these two critical pathways, Mounjaro helps to regulate blood sugar levels more effectively, and may also contribute to weight reduction, which is a significant concern for many diabetes patients. While more research is needed to understand its long-term effects and safety, Mounjaro holds immense promise for the future of diabetes management. Ongoing clinical trials and studies are essential to determine its efficacy over extended periods and to identify any potential side effects that may arise with prolonged use. As with any new medication, it's crucial to approach Mounjaro with cautious optimism. Patients and healthcare providers must weigh the benefits against the risks and consider individual health profiles before starting treatment. It's not a cure for diabetes, and it's not suitable for everyone. Some patients may experience side effects and others may not respond as well to the treatment. Therefore, personalized medical advice is essential. However, for those who are candidates for this innovative treatment, Mounjaro could be a game changer, offering hope for a healthier and more fulfilling life. With the potential to improve blood sugar control and aid in weight management, it represents a beacon of hope for many living with type 2 diabetes. Section 11. A word of caution: consulting your doctor. This essay provides a general overview of Mounjaro and should not be considered medical advice. Before starting any new medication, including Mounjaro, it's crucial to consult with your doctor. They can assess your individual needs, medical history, and potential risks to determine if Mounjaro is right for you. Remember, managing diabetes is a lifelong journey that requires a personalized approach. Work closely with your healthcare team to develop a comprehensive plan that includes medication, lifestyle modifications, and regular monitoring to effectively manage your condition and live a healthy and fulfilling life.